Please come to order. Good morning. Welcome to Commissioner St. Mary's County meeting this date, Tuesday, May 18th, 2021. I am Randy Guy, President of the Commissioners of St. Mary's County. I'd like to introduce the other commissioners at this time. Sitting to my right, representing the 1st Commissioner District, which includes Ridge, Piney Point, St. George Island, Mr. Eric Colvin.
Good morning.
Mike Hewitt, who represents the 2nd Commissioner District, Leonardtown, Hollywood.
Good morning.
Sitting to my left, representing the 3rd Commissioner District, which includes Charlotte Hall, 7th District, Golden Beach, and Mechanicsville, Mr. John O'Connor.
Good morning.
Representing the 4th Commissioner District, which includes Lexington Park, some of California, Great Mills, and some of Hollywood, Mr. Todd Morgan. Dr. Rebecca Bridget, our County Administrator, is sitting at the table to my left.
Good morning.
Elisa Cassis, our Communications Director, is sitting at the table to my right.
Morning.
Amy Carter, our Video Media Producer, is behind the glass. Please turn your cell phones off or on vibrate. At this time, we have the invocation of pledge. Please stand. Dear Heavenly Father, please bless this commissioner's table here that we make the right decisions to continue providing for the people of St. Mary's County. Also, we thank you for the beautiful day we have right now. The weather is thoroughly warming up, and please bless that. But we do need a little rain, so pass a little bit down our way by this weekend sometime. With that said, amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to have approval of the consent agenda, please.
So moved.
Second.
Have first, second, all in favor?
Aye.
Nays? Ayes have it. Motion to adjourn as Commissioner St. Mary's County.
So moved. Second.
Okay, we move to adjourn to Commissioner St. Mary's County and reconvene the St. Mary's County Board of Health. Board of Health will be presented by Dr. Brewster, our health officer. Morning, Dr. Brewster. All kinds of good news this week.
Yes, we do have some good news. Good morning. How are you all?
Very good. Very good.
Thank you. Thank you.
So should we figure you're unvaccinated? That's why you're wearing your mask?
No, and I'd be happy to talk more about that. I think there's lots of things that go into that decision, and be happy to talk about some of the factors that might factor into that. You can go ahead and start. Good morning, Commissioners. It's been a few weeks since I've been here, so I have a couple updates, including some data updates as well. You go to that link there, please. Thank you. Okay, great. If we scroll down the data page there, thank you. As of yesterday, we had 7,228 cases in St. Mary's County, and the weekly new cases, if you scroll down to the weekly bar graph, the weekly new cases has overall been trending down over the past month, and so has the new case rate, which I'll show in a moment, that sits at less than 10 new cases per day per 100,000 population. We are seeing more and more further down, please. We are seeing more and more variant cases being identified, and again, as a reminder, only a small number of our clinical samples are getting genomic analysis, which would then identify the variant viruses. Mostly the variants being identified are the UK variant. We have seen one South African and a few California variants as well.
Dr. Brewster.
I'm sorry, Brazilian. Mm-hmm.
The situation when we look at COVID around the world over in India is really difficult.
Yes.
Do they have a different variant going on over there?
They do have several different variants that have emerged, including one at least that's been identified as a variant of concern that has now demonstrated presence in the UK and also in the US, in certain places in the US as well. Yeah, so very concerning, absolutely, the situation in India, Taiwan as well, and Philippines and some other countries as well. And again, if you go down to the new case rate graph, you could see our downward trend in our new case rate is very encouraging. And we, hopefully this will continue forward. And, of course, we'll keep monitoring this and offering testing. We have added a new graph to our data page if you scroll down. It's the new case rate breakdown by age group. And as you can see, a little bit higher up, it's the one with the multiple colors. Yeah, there you go. So it's a busy graph, but if somebody's really interested in the age breakdown, you can follow the colors, and it'll tell you the new case rate. And again, these are averaged over 7 days, or it's a rolling average over 7 days. So it's the number of new cases per day per 100,000 population. And then in this, you can see the 20 to 39 and the 0 to 19 age groups are our most problematic when it comes to the persistent number of new cases. And this makes sense based on the facts that we also see lower vaccine rates in these age groups here in our county. If you scroll down to the RT estimate there, I think that's it, yeah. Sure. Oh, thank you. That helps. Excellent, thank you so much. All right, if you scroll down to that RT graph, scroll over, please, Ms. Cassis, thank you. Thank you, and you can see our RT has been fluctuating, kind of looks like a really bad heart rhythm. And however, we are seeing it starting to decrease down, and hopefully that'll continue on. And again, this is an estimate, as we've talked about, and there's a variety of factors that influence that. Lower down, we've been seeing an increasing trend. The only kind of concerning metric that we're following, if you go down, please. So we've been seeing an increase in our hospitalizations, daily COVID-related hospitalizations for St. Mary's County residents. If you go down to that graph right there and scroll over. Again, this is about, almost a week delayed, so we may be seeing lower numbers when we get the updated numbers next week. But generally, since April, overall, we've seen somewhat of an increase in hospitalizations in that trend, but hopefully we'll start to see that decline. Again, hospitalizations tend to lag behind cases by a couple, 2, 3, maybe more weeks. So this may be reflecting some of the higher rates we were seeing earlier. All right, and we'll continue to follow that closely. If you go down, please, and then we're at 124 COVID-related deaths in St. Mary's County residents. So overall, doing much better as a county, but we are definitely watching very closely those hospitalization rates and the rates of infection, particularly in that 20 to 39 age group. We definitely need to get more of them vaccinated. If you could go back to the slide set, please.
Dr. Brewster, they can't say that you don't have enough data on your website.
Yeah, we've had a lot of data there. Thank you. Yeah, well, our EPI team, really great people, very, very knowledgeable and skilled, including some people that we brought on just for support our surge response. And they analyze data every morning, every day, 7 days a week, and they've been doing this since the beginning of the pandemic. So it's kudos to them for staying on top of this and all the analysis that they do. And as I mentioned before, a lot of our metrics we calculate locally because we prefer different ways of reflecting the data than sometimes how the state reflects our local data. We feel like our way of doing it is a little bit more accurate in our eyes. All right, if you move over to the next slide, please. Just some updates on testing. This is what you're familiar with, and we are continuing with these locations for COVID-19 testing. We hopefully will soon have access to the PNC Bank facility, and we'll be able to convert our Lexington Park testing location from where it is currently at our harm reduction office to the PNC Bank location. If you go to the next slide, please. I'm really excited to announce that over the past handful of weeks, we've been doing some rapid PCR testing, thanks to the awesome work of our Department of Public Works and Transportation and renovating the Health Department laboratory so that we're able to use the rapid PCR testing machine. We have recently expanded access to those rapid PCR tests. So currently, or previously, we launched it for symptomatic first responders and healthcare workers in our county. We've now expanded it to include symptomatic children. So anybody 17 years of age or younger who has any symptom of COVID-19, or if they've been identified as a close contact due to a close contact with a positive COVID case, they would be eligible to get this rapid PCR testing that we're offering at the health department. As well as these other groups here that are listed, and we've also expanded to now include symptomatic or close contact that work in school or daycare settings. This is not for travel screening. For screening after you get back from travel or before you go to travel, this really is just for symptomatic individuals who fall in these categories, or for individuals who are close contacts who fall in these categories. This is only available at our Leonardtown Health Department main office location, and there needs to be a call ahead for using the rapid PCR. So we also operate a regular PCR testing, which usually takes about 2 days or so for results to come back. But the rapid PCR could take up to 4 hours. Oftentimes we'll have it ready within the hour, but it just depends on the volume and demand that we're having. So the call ahead is really important, and we are really excited to roll this out. I think it would help get people back into school and work quicker.
What's the accuracy rate on that?
Yeah, so the PCR testing is the gold standard. I'm really glad you asked that, Commissioner. So PCR testing is the gold standard for diagnosing COVID. The antigen test, the rapid antigen test, which many people have been getting at urgent cares, remains much lower in its sensitivity and specificity. So that means that it has higher number of false negatives and higher number of false positives, that antigen testing. If you can remember, we've talked, several times about the concern with that.
Is that like 100% effective?
No, I mean, most tests, you won't have 100% effectiveness, but it kind of depends on the scenario. But most of the time, the PCR test, if you wait until about a 5-day mark, especially after you've had some exposure, if you're doing it to see if you have COVID, it's 98, 99% kind of thing for sensitivity. If you are actually symptomatic, that's also a good time to get PCR testing, because by the time you have symptoms, the virus may have bred enough to be able to result in a positive test. So PCR testing has gotten a lot better as our technique of swabbing has gotten better too. So it is the gold standard, and it is what we recommend people to get tested with, particularly if they're close contacts or have symptoms.
Thank you.
Thank you. Great question. All right, if we could go to the next slide, please. Thank you. So just some updates on our COVID vaccine webpage, and I'll dive into what's available. And I do want to introduce at the bottom this free new digital vaccine card that we've rolled out for our county in partnership with a Maryland-based software company called Pinpoint. If you move on to the next slide, please. Thank you. So new since we last met, we've expanded the age eligibility for a vaccine. So anyone who is 12 years or older is now eligible for vaccine. The health department has all 3 vaccines that are currently under emergency use authorization from the FDA: Pfizer, Moderna, and Johnson & Johnson, or Janssen vaccine. The Pfizer vaccine is the only one that's open for people who are less than 18 years old. So the 12 to 17-year-olds, we've got plenty of Pfizer clinics. There's plenty of eligibility, plenty of appointments available, including right now this morning, where people can go and get a vaccine, and the website's there.
Dr. Brewster,
Sir?
might sound crazy. High school's getting ready to start graduating. And I know they're not going to be doing a big outdoor or gymnasium event. Have we thought of offering shots when the kids walk off the stage?
That's brilliant. I don't know if they'll want that, but we have offered it to the high school students, as you know, and we're continuing to offer it and promote it to our 12 to 17-year-old population.
Got a captive audience when they're walking off the stage with that diploma.
Sure. I'll certainly pass that on to Dr. Smith.
Dr. Brewster, when a long time ago, 50 years ago, when I graduated high school, the time in between when seniors were finished and we graduated, we had that practice period. A couple days we had to go and practice. And the point is one day after practice, they made us all go into the school, and we had to register to vote. They said, now that you're this age, you can vote. So that might be a good idea to do it during that time versus the actual
I don't care
ceremony.
what you do. I'm just thinking,
Good idea.
This is the period, and you got a captive audience of
Yeah.
500 kids per school.
Great ideas. I love that.
Dr. Smith?
Hopefully Dr. Smith's watching right now, and maybe I'll have a conversation with him a little later. Thank you. All right, so this is the vaccine record. So this is new. We've rolled this out fairly recently, and encourage, just like when you go to a doctor's office and you get blood drawn and you want a copy of your lab results, or you go to the hospital and you want a copy of your medical records or the report from your x-ray, that's what this is. This is a copy of your medical record and your medical information for you to keep. A lot of people have been losing that paper CDC card. I'll admit I lost mine. So, yeah. And it's easy to do. It's a little piece of paper, right? But the nice thing about this is an authenticated vaccine record from the state immunization registry. And just like, when you keep your medical records, this is another way to get your medical record digitally for your COVID vaccine. As I mentioned, we partnered with a company called Pinpoint who developed this vaccine check platform, and it's available on our website. If you go to the next slide, I'll go through it in a little bit more detail. This is what it looks like. The profile, they're easy to read dates of your vaccine doses, including your final dose. You can upload an image of your original CDC paper card, right? Which is really nice because some people like that memento. I mean, it's a pretty significant thing to do, and you want to keep that memory. That's fine. You can enlarge that if you have it available. You also will get a digital card that's downloaded from the state immunization registry once you input some information that allows them to get access to that record. This is a HIPAA compliant platform, and that's why when people sign up for this card, they have to input certain information that needs to match their state immunization registry record. And it is free for all St. Mary's County residents. Charles County will be rolling it out soon, and hopefully there'll be access for Calvert residents as well as we move forward. This is easy. A lot of some employers are now looking at doing vaccine incentives to encourage their workforce to consider vaccine, and if their workforce gets the vaccine, then they may offer an incentive. The state of Maryland just rolled out something as well. And so it's an easy way to send to your employer HR office, hey, here's a copy of my vaccine record. You can just screenshot it from your smartphone and send it in.
So is this an app that you would have to download? Or?
So I'm not an IT professional, and I'm not familiar with all the distinctions there. It is, I guess it's a software, it's a platform. It is something where there are links that you can download, an easy to hit button on your smartphone to be able to access your own personal card. I don't know if it meets the criteria for an app.
Interesting.
All right, so who's getting vaccinated? This is where we are currently in the county as of yesterday. So far, almost 50% of our total population has now received their first dose. Again, this is first dose. This is not full vaccination status. If we just look at our 18 and over adult population, we are still sitting at less than 50%, or I'm sorry, about 55%, less than 40, about 42% have had their full vaccination status. So we've got a little ways to go, certainly, but I think these are really positive, encouraging numbers that are allowing us to feel safer in doing a lot of things that we didn't do before or that we put on pause. And it is something we want to keep working on. I'm definitely encouraged by the number of seniors, though, that have gotten their vaccine. We'll start to see that number of 17 and under rise as more and more of our 12 to 17-year-olds take advantage of being eligible now for vaccine.
Dr. Brewster, your counterpart from Charles County was on the local radio station this morning when I was driving over, and she was stating that where we're at 85.6, Charles County's at 71 or 74.1.
For seniors?
For the seniors, and where we're at 48.5, they're at 41%. So they've got a ways to go to catch up with us.
Yeah. Well, I mean, every county is doing, they're fortunate to have that state-run mass vac site right in their backyard as well. But yeah, every county has different things to consider and barriers and whatnot, but I think.
Good job.
Okay, well, thank you. It's been, as you know, a huge team effort across our community. So thank you to all of you for your support and all the different partners that have been working with us at the Health Department to get this done. All right, in terms of our racial ethnic distribution, as you know, we've been monitoring this because of the concerns we saw early on with disparities in vaccine access. We have definitely turned the tide on that. We've seen a much better rates of vaccine adoption in our African American residents, as well as residents who identify as Hispanic in ethnicity. Get Out the Vax campaign, again, focus of that is to improve vaccine uptake in our county, and some just updates from that. We continue to do some canvassing in a variety of neighborhoods to encourage people to have the information they need so they can better decide on whether or not to get vaccine. And we have now shifted our strategy to smaller on-site mobile vaccine clinics. We've been really very focused on a mass vaccine strategy through the Hollywood Volunteer Fire Department location for many months, and for good reason. We'll continue that effort, and as we start, preparing for the possibility of future booster doses for our population, we'll need to maintain some presence there as well. But now we know that we are trying to overcome whatever barriers people still have to getting a vaccine, and are really doing our best to try to get out there into various places in our community and to have perhaps smaller or more location-friendly, I should say, vaccine clinics.
Dr. Brewster?
Yes, sir.
I was looking at the slide in reference to vaccination for African Americans, and it said 13%.
13.8.
Is that 13% of that community based on the census data?
Yeah, so if you go back to that pie chart there, it's 13.8% of the vaccines for the first dose vaccines that have been vaccinated for the African American residents.
Okay, because I just wanted to make sure, because I think our population is roughly 15%.
Correct.
African
15 to 18 even sometimes.
Yeah, 15 to 18. So if it was that segment of the total population, I would say you're leading the way in the entire state. Based on that, because that's more than 50%.
Yeah.
Every place, and even in some of the, like Prince George's, they're not even close to that.
Yeah.
And so that's amazing, the efforts that you've been leading there.
Well, we've made some significant strides in that. If you recall, when I first presented and talked about the Get Out the Vax campaign, I think we were sitting at about 7 or 8%, if I don't remember exactly, but somewhere around there. So we definitely have seen significant improvements in vaccine adoption in our African American residents, and some of that is also expanding eligibility categories as we move through. More and more residents are now eligible. So, but in no small part due to the great partnership that we have with our local NAACP chapter,
Right.
and also our Minority Outreach Coalition. They've been phenomenal partners in this effort. Great. So I just want to touch base on this and encourage groups in the community, organizations in the community, whether you're a church or a business or some other community organization or whatnot, neighborhood, whatever it may be, please reach out to us. We'll be happy to consider coming on site to offer some kind of vaccine effort at your location. I do want to mention that employers really can have a significant role in encouraging our population to continue getting vaccine and to support. This makes sense from an employer perspective. I mean, you have less workforce that ends up getting quarantined. You have more of less potential health care costs associated with the health insurance that you may be offering to your employees, and generally just less hassle when somebody gets infected and has to be out of work. So this, we really do want to offer our employers, especially larger employers in our county, the option of hosting a first dose vaccine clinic on site, or an only dose vaccine clinic if it's J&J, and then we'd be happy to arrange for those employees their second dose at another location. We also have a variety of communications materials that employers can utilize in their employer setting, and I'll show a picture in a moment. And then, again, encouraging our employers to consider offering vaccine incentive programs, like I mentioned, like the state of Maryland has been doing. Appointments are currently available at our website for vaccine. Okay. And that's it, Commissioners. I'd be happy to answer any questions.
I do. I have a question, which is more of a balancing act in reference to ADA and HIPAA. So we've seen a lot of big box stores and other places that are saying, if you're vaccinated, you don't have to wear a mask, but if you're not, you have to wear a mask. And the balance between the public's right to know and a person's own privacy and rights, that some are constitutionally protected. So if I go someplace, I don't have to tell somebody my disability because I have a dog. Oh, I forgot, a comfort dog, right? So what makes it so that somebody would have to say whether they're vaccinated or not? I mean, I'm protected under HIPAA and ADA where I don't have to say anything, and when are people's rights violated by not being able to enter unless they just have a blanket policy?
Sure, sure. And great question. And I know this is being discussed nationally at many levels with lawyers who are far more familiar with the legal implications of that topic, is the right, the ADA aspect of it, but then also, like you said, the privacy aspect of that information. So I don't have an answer for you other than to say I know this is something that's being discussed quite extensively right now. We have, right now, the policies that we have in Maryland are encouraging people who are not vaccinated to, one, get vaccinated, but then two, to make sure to, implement some of those precautionary measures that we've been employing since the beginning of the pandemic, the masking, social distancing, especially in indoor settings.
I mean, basically, like HIPAA lays out now, if I had military, I got anthrax, smallpox, all that great stuff.
Sure.
Nobody can ask me what I got vaccinated for and tell me I have to wear something.
Yeah, I mean, HIPAA applies to HIPAA-covered entities, which are primarily healthcare facilities.
Okay.
So a retail store wouldn't necessarily be a HIPAA-covered entity.
Okay.
They can ask, and if a person decides to share that information, that's up to them. It's not they're not violating HIPAA by asking.
Okay, I think that was where I was going with.
Yeah, HIPAA would only apply to those specific entities
Healthcare.
that are covered by HIPAA.
Right.
And it's not, HIPAA doesn't restrict you from asking. So as a physician, I would be HIPAA covered through my healthcare entity, the health department, but it doesn't restrict me as a physician from asking about vaccination status on my patient. I mean, that's part of my job.
Right.
But it would restrict me from disclosing that information to some other party that doesn't need to know when I haven't yet obtained consent from that patient.
Yeah, it's just, you see a lot of the stuff going on and a lot of the misinformation. So,
Yeah.
I just want to make sure people don't have to tell anybody whether they are or not, but a private entity does have the right to refuse service to anyone they choose to. So whether you want to answer or not, that's up to you, whether you want to wear a mask or not, and it's optional if they decide that that's what you're going to do. No shoe, I think I said it before, no shirt, no shoes, no service.
Yeah, and as long as they're not discriminating based on any of those protected classes in the civil rights laws.
It becomes a very touchy subject. So,
Yeah. I don't know that vaccination status is a protected class, though.
Yeah, no, I don't think so.
So, Commissioner Hewitt, you'd asked about me wearing my mask, and I have to say I spent a lot of time thinking about that and coming to my own personal decision on this. I was vaccinated back in December, so it's been several months since I started my vaccination process, and we aren't yet clear on how long the immunity from these vaccines lasts. We think it's about 6 months. It might be more, but we're still waiting on some definitive science on that matter. We do think that there's probably going to be some level of booster doses down the road. We're just not yet sure on the timing of that. I'm also a healthcare provider who's working with a variety of people in the community who are not vaccinated. I'm also a mother of 2 children who are not vaccinated because they're under 12. And so I think, when we make our personal decisions on whether or not to mask, it's important for us to consider none of these decisions are black and white decisions. They're all within a context, a variety of circumstances. So when I was making my decision, I considered those circumstances. I also considered that this room is an indoor, poorly ventilated space, not a poor reflection on the county, but there's no windows and so forth. That there are a variety of members of the public in the room that I'm not aware of their vaccine status. I know my vaccine status. I know all of your vaccine status. but I don't know, everybody's vaccine status in the room. And so for my comfort level at this point, when we have not yet vaccinated even half of our population here in the county, based on what we've been seeing and based on the emergence of these variant viruses, I've made a decision personally to continue wearing a mask indoors in spaces where there are other people that I'm not really familiar with, and in particular people that are members of the public that I may not know their vaccine status.
Well, it wasn't necessary to explain it to me.
No
You're right
problem.
about your personal decision, and I totally agree with that, whatever your personal decision is. I would say to you, though, I remember reading yesterday on the internet, so it must be true, that there was a group of nurses, or association of nurses, that did not agree with the CDC.
Yeah, there's many healthcare professionals that don't agree with the CDC.
But I do remember the lady, I can't remember her name, a CDC director, saying if you've been vaccine, if you had the vaccine and you've gone through the protocols, that you will not give it to somebody else. Now, you think she's wrong?
Well, actually, that is incorrect. We have seen people get COVID. Even in our county, we've had breakthrough cases of COVID in fully vaccinated people. Very publicly, there have been baseball players who've clearly passed on the virus to each other even after being fully vaccinated. These vaccines aren't 100%. They've never been billed as being 100%. Moderna and Pfizer, they've got great effectiveness. Some of the best effectiveness and safety profiles, by the way, but some of the best effectiveness of any vaccine that we have. Those Moderna and Pfizer vaccines, 90+% in preventing infection, and then also maybe even higher in preventing severe illness. But that's not 100%. There still have been breakthrough cases, including here locally. And the Johnson & Johnson vaccine the effectiveness profile has been, upwards of 70%, closer, somewhere around there. And so I think, we need to, again, nothing's black or white, nothing's 100%. We are in a phase where we are really excited and encouraged about the trends that we're seeing in this pandemic. But we're not there yet. And I think we need to keep in mind that there's a lot unknown still, that we're still figuring out. I mean, that's why it's a pandemic, it's unknown. And as we move forward, we'll take steps, and we may, move things around as we need to. But right now, I think we're in a place where it's reasonable for people who are vaccinated to, for sure, not wear masks outside, but indoor settings, make that decision on whether or not they want to continue wearing masks.
Well, I agree with you, and my point also gets to be the governor has also relaxed it. The commissioners usually follow the governor's decision.
Right. Yep.
I think Montgomery County has decided to keep more restrictive, and we can do that. Are you recommending that we be more restrictive?
So no, I'm not, and I've had that conversation with Dr. Bridget, and I think Commissioner O'Connor, I spoke with you this past weekend as well. So at this point, I'm not recommending a local order that would say otherwise than what the governor has already put out. I am recommending that people very carefully consider their vaccination status, get vaccinated if they haven't been vaccinated yet and they're age eligible, and that people also, really consider the circumstance. Are they going to be in an indoor setting with members of the public and so forth when they decide to get vaccine? And who are they exposed to? Are they taking care of seniors or young children? I mean, what is their circumstance in their personal life? I'm also, really encouraged that the governor maintained masking recommendations for congregate facilities and healthcare facilities. I think those settings are where we are particularly concerned. So places where seniors gather, places where seniors and others are receiving healthcare services, and other places of congregate living, such as detention centers and homeless shelters and so forth. I think those are the spaces that we are, and schools, frankly, where most of the people have not been vaccinated. Those are the settings where we are, where we really need to continue as best as possible our COVID precautions, particularly the masking. Thank you.
Dr. Bruce, the one thing,
Sure.
I took a break from wearing the mask today because we're no longer legally required to wear it inside, but I can tell you I agree with you that if there's a place where there's a large gathering or an unknown, I probably will. I know in other aspects I'll have to wear it based on my interactions. So also having a young child and my in-laws that can't be vaccinated. So I think there's a balance for people, and people have to make those decisions. The other thing is thank you for taking the call this weekend, and I'm sure you were fielding some. I know Dr. Bridget was. There is an old email, as we discussed, floating around that was prior to the lifting, and some stores are still pointing to it and saying, nope, the health department said we have to, you have to wear your mask. So you and I both know that email is old. If you don't mind just letting the public know that email is old and it's lifted and you can't point to the email anymore. We've come up with a different policy if that's what you want.
Yeah, sure. We have regular communications with our business partners in the community on this very rapid pace of changing regulations and so forth at the state, executive orders. So yes, that email communication that you're referencing that we talked about on Sunday or Saturday, whatever day it was we spoke.
Yeah, the email dated from May 14th.
Sure. It may have been Saturday.
Yeah.
So that email communication was predated the governor's press conference that came Friday evening, which lifted masking requirements for both indoor and outdoor settings. We are not issuing at this point in time, I haven't brought in front of you as a Board of Health a request for any different orders in that regard, and we are still encouraging our business community to look at their workforce and think about the protection of their workforce and customers and make a decision that makes sense for their private setting as to whether or not they want to require masks.
So the business community can still require you to wear a mask when you're inside their business right now.
So there are some places that are, there are some places that are not.
In a store yesterday, they required the mask.
I'm sorry?
They required a mask.
For
They wear a mask inside a store.
a particular store?
I put my mask on. I said, well, they've lifted that on Friday. He said, we know that, but our partners have not decided to lift it yet.
Yeah. I think the lifting went into effect Saturday, after the Friday announcement.
Right.
And again, it's up to the store. I mean, just like they say, no shoes, no service. This may be one thing that they decide to do in an effort to better protect their employees. And this is where it's helpful for them to have an idea about their employees' vaccination status too. If they have a largely unvaccinated workforce, they may want to consider that as a good business practice of protecting themselves from absenteeism and higher healthcare costs.
Right.
And employers, just to go back to your question, Commissioner O'Connor, the federal EEOC has indicated that employers can ask their employees their vaccination status, that is not a violation of federal laws.
Oh, yeah.
Well, perhaps, Dr. Brewster, Mr. Castellanos is here, and through economic development, maybe the Chamber of Commerce and some other organizations, they can get a better clarification out there for everybody.
Yeah, thank you. And thanks for bringing that up. And I also just want to recognize Director Castellanos for his partnership and partnership with the Department of Economic Development. We recently have had some good conversation about ways to encourage and support our business community in offering vaccine incentive programs for their employees. And this, I think last week, I had the honor and the opportunity to speak with some members of the Patuxent Partnership as well about that.
Well, I'll tell you, one thing I'm very, very happy about, and I know there's a lot of parents that are very happy about, is based on the lifting of the mask mandate, the cooperative relationship with the Board of Health, there's more. Originally, it was only going to be 2 tickets for graduation, and now
They've increased
it's
that.
4 tickets for graduation, and that means co-parenting can now, co-parenting households can attend, and let me tell you that the excitement behind that is great. So thank you for working on that, and I'm just glad the timing was great, especially for some of these proms that were going on. I mean, literally, you couldn't ask for better timing.
Yeah.
It was just great.
And better weather. The
Yes.
proms were mostly outdoors, and wow, what fantastic weather those kids
Yeah,
had.
it was perfect timing. So
Great.
I appreciate your help with that and working with everybody to to get forward on those graduations.
Thank you, sir. We appreciate the school system and kind of our daily communication with them and everything they've done to try to give students a better experience this year than what they were able to have last end of school year.
Yes. Very good. Any other questions, Commissioners? Thank you very much, Dr. Bruce, for everything you've done for the county and for your time today.
Thank you, sirs. Appreciate all your support.
Thank you, Dr. Brewster.
Mr. President, I move to adjourn as the St. Mary's County Board of Health and reconvene as the Commissioners of St. Mary's County.
Second.
First, second, all in favor? Aye. Any nays? Ayes have it. Next, we're going to jump right into a public hearing. Department of Land Use and Growth Management, public hearing. Proposed ordinance to allow private piers in waterfront subdivisions that were platted prior to December 31st, 1994, that have a community pier. Mr. Bill Hunt, Director, and I think the Deputy Director, Mr. Harry Knight, is also here, if needed. Bill, you got it.
Thank you, sir. I believe there's a little bit more of your introduction for a public hearing.
Oh. Got to do more?
If not, that's my mistake.
Just want to say, okay, you're right. We will now open the public hearing on the proposed ordinance to allow private piers in the waterfront subdivision that were platted prior to December 31st, 1994 that have a community pier. Mr. Bill Hunt presenting.
Thank you,
Got
sir. Good morning, Commissioners, Dr. Bridget.
Good morning.
The Code of Maryland regulations for the critical area allows private piers in subdivisions platted before December 31st, 1994, when there is a community pier. The St. Mary's County zoning ordinance prohibits private piers when there is a community pier without exception. The amendment to the county zoning ordinance before you today will allow the same exemption as state law. Critical Area Commission staff were sent a copy of the ordinance that is being reviewed at this public hearing. After you agreed to have this public hearing, I sent them a copy of the text that you have, and they responded back that, quote, "We see no conflict with the critical area law or regulations with respect to the amendment that you're having the public hearing on today." So far, there have been 4 letters in support of this amendment, and Land Use and Growth Management is not aware of any opposition. We haven't received anything coming from the commissioners to us or from any individual contacting the department.
Okay. Okay, I now turn it over to Dr. Bridget, who will give provide a format for the public hearing.
Thank you, Commissioner President Guy. This morning's public hearing, May 18th, 9:30 a.m. Here are the guidelines for the Commissioners of St. Mary's County Public Hearing for the Office of the Department of Land Use and Growth Management. Public hearing. Proposed ordinance to allow private piers in waterfront subdivisions that were platted prior to December 31st, 1994 that have a community pier. If you wish to address the Commissioners via teleconference, please call 301-475-4200, extension 1234, to provide your name and address for the record. You will then be given an opportunity to speak to the Commissioners through the phone conference. All speakers who wish to address the Commissioners in person are asked to fill in the sign-in sheet located in the lobby of the Chesapeake Building. All speakers will have an allotted 3 minutes to address the Commissioners. At the end of the 3 minutes, our Communications Director, Elisa Casas, will let you know that your time has expired. We ask that you respect the 3-minute time limit in order to give all those who wish to participate an opportunity to be heard. The public hearing is being televised live on St. Mary's County Government TV 95 and the county's YouTube channel. If you should miss any part of the hearing, it will re-air on Channel 95 this Friday, May 21st at approximately 7 p.m. and will remain available for on-demand viewing on the St. Mary's County Government YouTube channel. Citizens were provided an opportunity to address the Commissioners via video submissions, but because we didn't have any for the public hearing for the proposed ordinance to allow private piers in waterfront subdivisions that were platted prior to December 31st, 1994 that have a community pier. We will now begin accepting comments from those who have signed up to speak in person. Sharon, do you have anyone signed up to speak in person? Great, thank you, Sharon. First, we have Donald Gladue. to speak on the public hearing. You're welcome. Good morning.
Morning. Good morning. Good morning, Commissioners. Thank you for taking the time today to receive input from the community regarding this topic. My name is Donald Gladue. I reside at 44540 Shallow Ford Court, Tall Timbers, Maryland, 20690. I'm here today with my wife, Dee Dee. We are here today to show our support in favor of the proposed amendment to allow private piers and subdivisions that were plotted before December 31st, 1994, to have a community pier. Some of the advantages we see allowing the subdivisions currently affected by this ordinance or to allow personal piers are as follows. Raise our property values. Excuse me. Recently, we had a house that was for sale 3 houses down from where we currently reside. It went under contract. The folks found out that they couldn't have a personal pier back to the creek of their property, and they backed out on the sale of the house. Also, it would bring St. Mary's County in line with the rest of the state of Maryland. Taxation without immediate water access. We're currently paying for waterfront property, yet we can't access the water from our property because we can't have a pier or a floating dock. Unable to launch a kayak or canoe from our current existing community pier, just because it's too dangerous. The pier's too high to try to put a kayak in. Also, there is currently no crabbing and fishing allowed from the community pier. If folks were able to have their own piers, they could certainly crab and fish from their own piers. My understanding is our HOA BOD is going to provide a letter to the commissioners in support of the proposed amendment. Currently, we have 95 lots in the landings, and after going door to door, with another couple in our community, over the last 2 weeks, we were able to make contact with 74 of the 95 owners. We received 68 votes with signatures in favor and 6 negative responses. That equates to 92% in favor of the proposed amendment. Again, I'd like to thank you for your consideration on this amendment. Thank you.
Thank you.
Thank you, sir.
Thank you. Elisa, we'll now begin accepting comments through our teleconferencing system.
Thank you, Dr. Bridget. Good morning. Thank you for calling in to participate in the Commissioners of St. Mary's County public hearing for the proposed ordinance to allow private piers in waterfront subdivisions that were platted prior to December 31st, 1994 that have a community pier. Please remember, you are allotted 3 minutes to address the commissioners, and at the end of the 3 minutes, I will let you know your time has expired. Please speak directly into your phone. Good morning. You may begin your remarks now.
Hi, this is Kirby and Ann Sutton. Hello?
You're on. Yes, please address the commissioners.
Okay. Thank you. This is Kirby and Ann Sutton, and we certainly appreciate the opportunity to address the commission today and provide some input, and thank you for seeking it. We recently purchased a lot in Colson Estates, and at 44882 Main Driveway, Piney Point, and we are building a house there, and we'll be moving from Virginia to the new house. And currently, we have the opportunity to build a community pier, but the HOA hasn't built the community pier either. So right now, we have no pier, community or private. And because we have dozens of piers to the left of us and about 10 piers to the right of us, we have 11 lots right in the middle of the beach that don't have anything. So to anyone in a boat coming over from Virginia or just cruising down the river, it looks like an open beach. So we have a lot of people that just come and beach their boats and come up onto our beaches and party, and especially where we're building, there are 5 open lots that don't have any houses on them, so everyone thinks that's just an open beach. And so we have a lot of trash, we have a lot of people that come and build fires, we have people that drive down Lighthouse Road and park and come and sit on the beach. And they don't do that with any of the lots that have piers, only the lots that don't have piers. So I agree with everything that the first speaker said about all the benefits of having a pier, increased property values, and being able to, crab off the pier and things like that. But for us, it's really also we'll call it an invasion, but a lot of the folks coming across the river and kind of using our beaches, and then after they're done with them, they just get back in their boats or jet skis and go back home. So again, thank you for the opportunity to speak today, and I hope you consider what I've said, and have a good day.
Thank you very much for your remarks.
St. Mary's County Government Public Hearing Line.
Good morning, Kathy. This is Elisa Casas. I'm calling to see if we have any further public comment line for this morning's public hearing for the proposed ordinance to allow private piers in waterfront subdivisions that were platted prior to December 31st, 1994 that have a community pier. Do we have any additional callers on our teleconference line?
We have no other callers on our holding line.
Great. Thank you, Kathy. Dr. Bridget, Commissioners, those are all the calls we have this morning on our teleconference line for this public hearing.
Thank you, Ms. Casas. Commissioners, please note that the public comment period will remain open for 7 days until close of business on May 25th. Should the public wish to send an email to csmc@stmarysmd.com or U.S. mail to P.O. Box 653, Leonardtown, Maryland 20650. Commissioner President Guy, Commissioners, that concludes our public hearing.
Thank you, Dr. Bridget. Thank you, Ms. Cass. This closes our public hearing.
Thank you.
Next, we have numerous proclamations this morning. First, we have the National Safe Boating Week, which will be given by Commissioner Hewitt. For those here representing, please come forward.
This proclamation will be accepted by Commander John Torres.
Sir.
Advanced Pilot, Patuxent River Sail and Power Squadron, Incorporated, and past Commander Kenneth Perigo, Senior Navigator, Patuxent River Sail and Power Squadron, Incorporated. I'm sure that's you two gentlemen. And I miss my good friend Hal Willard, who used to come and do this with us, and all had his life preserver on so he could keep us all squared away. As a boat owner, I take pride in giving this reading this today. Whereas an average of 650 people die each year in boating-related accidents in the United States, and nearly 80% of these deaths are caused by drowning, with the vast majority of these accidents determined to be human error or poor judgment, and not by the boat, equipment, or environmental factors. And whereas around 83% of boaters who lose their lives by drowning each year would be alive today had they worn their life jackets. And whereas modern life jackets are more comfortable, attractive, and wearable than styles of years past, and deserve a fresh look by today's boating public. And whereas the Patuxent River Sail and Power Squadron has provided boating education to the citizens of St. Mary's County and Southern Maryland for over 65 years. Thank you. And whereas the successful completion of the Maryland boating course meets the educational requirements for boat operations in all states. Now, therefore, we, the Commissioners of St. Mary's County, do hereby proclaim the week of May 22nd through 28th, 2021, National Safe Boating Week, and the start of the year-round effort to promote safe boating and urge all citizens to wear it and practice safe boating habits.
Commissioners, thank you very much. We appreciate this proclamation and your support of all the activities, safe boating activities here in St. Mary's County. As you know, our waters are cherished, and so safe boating is a key to all of that enjoyment. So thank you very much.
Okay, Commissioner, you want
Anything else from the task commander? I guess he.
But this has been multiple times that I've been here to the honor of receiving this, and I do appreciate it each time.
Thank you.
Thank you.
Thank you, gentlemen.
Thank you. Thank you. Okay, next we have the National Emergency Medical Service Week, and Commissioner Colvin will be presenting that.
Very good. So this proclamation is going to be presented to Director Steve Walker, Sean Davidson, the Emergency Medical Services Chief, and Carol Bohm, the Chair of the Ambulance and Rescue Squad Association. So if you all would like to come forward and have a seat for a few minutes. Thank you for being here. So this proclamation reads, whereas every day of the year at all hours of the day and night, citizens rely on emergency medical services, EMS, professionals and volunteers for critical care in our homes, on our roads, in our hospitals, and wherever the need exists. And whereas a key to the success of the EMS system is the impressive combination of courage, expertise, dedication, and compassion which distinguishes the performance of its personnel. Let me read that sentence again, slower. Whereas a key to the success of the EMS system is the impressive combination of courage, expertise, dedication, and compassion which distinguishes the performance of its personnel. The aid they administer often requires split-second decisions essential to preventing disability or death among their fellow citizens. And whereas EMS Week honors thousands of trained and certified volunteers and career first responders, emergency medical technicians, cardiac rescue technicians, paramedics, medevac pilots, communication specialists, and emergency department and trauma center personnel, EMS providers spend long hours to further their medical education, train themselves on the latest life-saving techniques, and maintain vital emergency equipment. And whereas the efforts of these brave and competent men and women in saving human lives and minimizing the disabling effects of injuries merit recognition and appreciation from their community, now therefore we, the Commissioners of St. Mary's County, do hereby proclaim this week of May 16th through 22nd, 2021, Emergency Medical Services Week, and urge all citizens to observe this week with respect and appreciation. Thank you all.
Steve, we'll
Looking
start
at
with
me. So Mr. Stamey is out running a call, just to talk about dedication. He's out assisting another ambulance that has a patient on board and has gotten a blowout. So he's helping to work through that, so he couldn't be here for that. But I can certainly talk about the dedication I see every day in this county, and it's phenomenal. But we have somebody down there at the other end, and we certainly have Carol here, who are very well spoken, but the one down there talks a lot, so he might want to make a few comments.
He acts like he knows me or something. I feel a little underdressed. I get to leave here to go work in support of the vaccine site today. So you got Carol and the fancies and me for the work today. It has been my honor and privilege for the last, it'll be 32 years in December this year, in volunteer service in St. Mary's for me. And it is an honor and a privilege to work for and in support of the citizens of St. Mary's County and the people who come here to visit and work throughout that time. It's the family business for me. Right now, we're going through some growing pains, and I understand and appreciate that. There are issues that we don't necessarily all line up exactly with. But at the end of the day, we are all people who are dedicated and willing to make sure that that basic service, that right to expect quality care when you need it and when it counts, is afforded to the constituents that we serve just as much as you do. So thank you. I am intensely proud of my association with every single person who is a part of this system. They don't all like me. I'm okay with that. I'm proud of them anyway. I'm proud of what these people do all day, every day. I'd throw my lot in with them again if I had that as a chance. So thank you, gentlemen.
Thank you. Carol?
Wow, what do I say after that? Well, I've been a volunteer in this county for 16 years, so half of what you've been. And you also said you were wearing the monkey suit today, so that's why I came dressed like this. But thank you, Commissioners, very much for the recognition today. The volunteers are here because they've got it here, and we want to care for the citizens of the county in the best way that we can. So thank you very much.
Thank you for all your service and your hard work, all of you. Thank you.
Right in the middle.
Next, we have National Public Works Week by Commissioner Morgan.
Thank you, Commissioner Guy. And accepting this award will be John Dietrich on behalf of Public Works. And is Zane here? Well, Zane's probably watching on TV, so.
Yes, Malone. Thank you.
Whereas National Public Works Week serves as an opportunity for citizens to acknowledge and honor the professionals who provide, maintain, and sustain our buildings and schools, roads and bridges, vehicles, equipment, water and sewer systems, utilities, emergency response needs, and other essential infrastructure services. Whereas National Public Works Week has been celebrated annually since 1960 by the American Public Works Association. The nationwide theme for 2021 is Stronger Together, which recognizes the vital role Public Works and Transportation and its dedicated staff plays in elevating modern society's quality of life as it speaks to the essential nature of Public Works and Transportation services in support of everyday quality of life. This is especially vital during these continued times of the COVID-19 pandemic. Whereas communities depend on Public Works and the contribution of Public Works and Transportation professionals play a critical role in the planning, building, and maintenance of infrastructure projects, which ensures that what we do today will become vital to the sustainability and vibrancy of tomorrow. Now, therefore, we, the Commissioners of St. Mary's County, do hereby proclaim the week of May 16th to 22nd, 2021, National Public Works Weeks, and call upon all citizens to acquaint themselves with Public Works service providers and recognize the quiet dedication and outstanding performance that these employees provide. Today, May 17, 2021. Thank you.
Thank you very much. I really appreciate the privilege of sitting here before you, listening to that proclamation. We've got 170-odd people in the department delivering those services and a number of contractors supporting us. But we've also got the citizens of St. Mary's County and their input into our 311 system with any issues they see or a call to the department is part of delivering the service. It's a big county, and we really appreciate hearing from people about what's right or what's wrong. Thank you.
Very good. Thank you. Okay, next we have a presentation from the Department of Aging and Human Services, symbolic check to College of Southern Maryland for the Jane Hale Cipher Scholarship Fund. For all those a part of it, please come forward. We have Cynthia Brown, Celeste Clute, Norma Pipkin, and is it Jasmine Bottoms? Is that right?
Jasmine's ill today.
Oh,
She
ill today.
wasn't
Oh,
to come.
okay.
I'm sorry.
All right. Well, welcome, ladies, and you may go ahead and speak at this time.
Well, good morning. Thank you for having us here today. This is an exciting day for the Commission for Women. Today, it's our honor to be able to present this symbolic check to the College of Southern Maryland and the Jane Hale Cipher Scholarship Fund. Jane Hale Cipher Scholarship Fund was established by the Commission for Women to meet a need that we saw at that time. This scholarship is unique in as much as it is for the non-traditional student. Person must be 25 years of age, must be a St. Mary's County resident, and present a financial need. So we're very excited about this. The funds for the scholarship come from our annual recognition benefit. And this year, like everyone else, we had some unique challenges. But with the help of very excellent staff here in county government, especially Sarah Miller, we were able to pull off an online symposium and still recognize some outstanding women.
And you had a phenomenal keynote speaker, too.
And a phenomenal keynote speaker. So we were delighted to recognize over 40 years of service from our friend Grace Fuller, who did everything from the soup kitchen to Summer Seat Farm and everything in between, as our Lifetime Achievement winner. Also nominated by Larry Ludwig, we recognized a young lady by the name of Emily Litton as our Woman of Tomorrow for her volunteer work with the Leonardtown Rescue Squad and the Girl Scouts. And finally, we recognized Debbie Fowler, who is doing a phenomenal job with a program called Sleep in Heavenly Peace. And they build beds for children, residents of St. Mary's County, that do not have beds available to them. And in addition to that, then they deliver them with the mattresses and all of the appropriate linens as well. So in March, Debbie and her volunteers had built about 250 beds and delivered them at that time. Their organization was nominated by the St. Mary's Optimist Club of Lexington Park. And so Debbie was honored with the Woman of the Year award. We are very, very grateful to all of our sponsors and for everyone that helps us with this important event of letting women know what their role is and how important that role is in volunteerism in St. Mary's County. So today, it is my honor to present to Chelsea and Karen from the College of Southern Maryland a check in the amount of $1,350 for the Jane Hale Cipher Scholarship.
Let's all turn around and get a photo op here. Thank you. Good.
Sure.
Go ahead. You say something there. Very good. Yeah.
Absolutely. So I wanted to thank the Commission for Women and the commissioners. We really, really appreciate this. This scholarship was started in 2010. We've awarded more than 30 students this scholarship, over $15,000. And back in 2019, we also created an endowment. So all the money that is raised from this event, we were actually able to create an endowment. So this will live on in perpetuity. And it's just so so exciting to see, what the Commission for Women has done, and with this partnership with the college, especially in a year like this. Our students needed these scholarships more than ever, and we were able to award these. And so I'd just like to thank all of you for what you're doing for our students, for the community, and for the college. So thank you.
Thank you. Thank you.
Next, we'll have the St. Mary's County Animal Shelter virtual groundbreaking. Welcome to the virtual groundbreaking ceremony for the St. Mary's County Animal Shelter. I am Commissioner President Randy Guy, and I am so pleased that this day has arrived. The animal shelter is an important project that will bring many benefits to our county, including having an animal adoption and care center locally that provides a haven for animals as well as a place for a community of people that value these animals. Many people have been instrumental in bringing the vision to life. Thank you to all who have labored. We will look forward to the completion of the facility and its opening.
For more than 5 decades, St. Mary's County has been a participant in the Tri-County Animal Shelter located in Charles County, Maryland. And of course, our partners were St. Mary's, Calvert, and Charles. So here we are. Congratulations. This is the groundbreaking for the St. Mary's County Animal Shelter. Congratulations to DPWT, to Department of Emergency Services, and to the many partners that were involved in this project.
I'm Steve Walker, and I'm the Director of Emergency Services for St. Mary's County. One responsibility we are tasked with is animal control services. Currently, when our animal control officers pick up animals, they must drive to the Tri-County Animal Shelter in Hughesville. That is 28 miles from the location of the new facility. On October 24, 2017, the Commissioners of St. Mary's County voted to build an independent animal shelter for our community. On FDR Boulevard in California, Maryland, behind the Staples Office Supply Store, in just over a year, the St. Mary's County Animal Adoption and Care Center will be completed and beginning preparations to open. If you're an animal lover, this is a joyous and exciting day. I would like to thank Dr. Bridget for her support throughout this project, Mr. John Dietrich, Director of Public Works, and Mr. Gary Whipple, County Engineer, for their critical work in leading the construction of this building. I also want to thank Dr. Pat Richardson, our Chairman, and all members of the Animal Control Board for their vital contributions. Their partnership has played an integral part in this critically important project. I also want to thank my staff and all who have worked on this project. It has been a long and arduous effort to get to this joyous day, our official animal adoption and care facility groundbreaking. Lastly, I want to thank the Commissioners of St. Mary's County for their decision to fund and support this program. Without their support, we would not have gotten to where we are today.
I'm John Dietrich, Director of Public Works and Transportation for St. Mary's County. One of the things we do is build and maintain buildings for other county departments and related agencies. Today, we're here on the site of what will be the new animal shelter and adoption center, a critical project for the Department of Emergency Services, so that they can improve the quality of care for animals that they encounter, primarily strays or abused animals that they have to seize. No longer will they have to take those animals to Charles County. This building and barn will enable much improved care. Please celebrate with me the exciting start of this construction.
This is a great day of celebration for St. Mary's County, thanks to the many people who have been working on the animal shelter. The Animal Control and Advisory Board has been tenaciously working to do their research, to examine best practices, and to offer ideas and suggestions to the builders. We would like to thank the county commissioners for their support and for making this project a priority. We also want to thank John Dietrich, Director of Public Works and Transportation, for inviting our input and for incorporating many of our ideas into his plan. And we want to thank Steve Walker for his vision and leadership, along with his staff, who have been very responsive. An animal shelter plays a vital role in a community. We can reunite lost pets with their owners. We can help reduce the population of unwanted animals through spaying and neutering programs with volunteers, local veterinarians, and animal welfare groups. And we can facilitate successful adoptions. Finally, we are ready to build strong partnerships with groups, animal groups throughout the county, and individuals who have an interest and beyond.
Good job to our communications director and staff. Amy did a great job. Thank you very much. Next on the main agenda, we have the Department of Human Resources Years of Service Award. And our HR director, Ms. Catherine Preston, will head the list of people who are getting their awards today.
Good morning, Commissioners. Good morning, Dr. Bridget. It's such a pleasure to be here today. We're going to present the Years of Service Awards, and the Years of Service Award recognizes employees with continuous service of 10 years or more, and the employees being honored this morning have spent much of their professional lives as public servants. Every resident of St. Mary's County has been impacted in some manner by the good work of these individuals. 74 county employees in total are being recognized for achieving years of service milestones during 2020. Today, it is my pleasure to present employees who have achieved 35, 30, and 25 years of service to St. Mary's County government and to the citizens of St. Mary's County. We are truly humbled by the commitment of these individuals and thank them sincerely for their dedication to county government. Without further delay, our award recipients, please come forward as I read your name. For the audience, please hold your applause until the entire year group has been called. And for supervisors and department heads in attendance, please come forward for a photo once the year group has been called forward. Our first awardee is, for 35 years of service, is Lieutenant Kenneth Cusick. Lieutenant Cusick could not join us today, but we wanted to take a minute and thank him for his many contributions to the community and his dedication. Employees celebrating 30 years of county service include Paul Reed, an equipment operator with the Department of Public Works and Transportation. Donna Sasser, a manager with the Department of Economic Development. Becky Trosbach, an accountant with the Department of Finance. Beth Collier, an archives manager with the IT department. And Captain Richard Gray, a correctional officer in the sheriff's office. Congratulations to all of you, and thank you so much for your many contributions to our community and to our organization. Ask department heads and supervisors to please join the group for a photo. That would be terrific.
Right behind you, by your person. Squish on in, squish on.
Slide right.
I was like, shuffle this way a bit. You're all. There we go.
There we go.
All right, let's make sure I can see everyone. What a group. All right. Congratulations to you all. We have a few other employees achieving 30 years of service who were not able to join us today, but in recognition of their contribution, I'd like to read their names. And that includes Ralph Ridgel from the Department of Public Works and Transportation, an equipment operator, John Wise, a lead inspector for the Department of Public Works and Transportation, Kathy Conlin, an office manager in the state's attorney's office, and Captain Ed Willenborg, a captain in the sheriff's office. Employees celebrating 25 years of county service include Alice Allen, manager for Senior Center Operations in the Department of Aging and Human Services, and Diane Gleisner, a coordinator in the Department of the County Attorney in the legal office. Congratulations. If you want to take a picture, and then we'll invite the department heads up. Thank you. And then any department heads or supervisors, please join for a photo. Congratulations, and thanks so much for your valuable contributions. Employees celebrating 25 years of service that were not able to join us today include David Koenig, a security specialist with the Sheriff's Office, and Joseph Somerville, a corporal with the Sheriff's Office. And congratulations to them as well. And thank you. Thank you.
Thank you very much, Catherine.
Thank you.
Thank you.
There's more to come later on. We sort of split the years up. The next couple of weeks, we'll have more and more.
We did, yes, yes.
Thank you very much. Yeah.
A few weeks in a row. So.
Thank you very much. Good. Okay, next we have the Department of Land Use and Growth Management decision, proposed amendment to the official zoning map of St. Mary's County to delete the existing 1,000-foot critical area boundary line and replace with the new critical area boundary line from the statewide base map as required by House Bill 1253. Mr. Bill Hunt, Director, Land Use Growth Management, presenting.
Good morning, Commissioner. Dr. Bridget, thank you very much. House Bill 1253, adopted in 2008, directed the Critical Area Commission to prepare a statewide base map to show a state-determined shoreline, landward boundary of tidal wetlands, and a digitally generated 1,000-foot critical area boundary. The critical area includes the waters of the Chesapeake Bay and the tributaries to the head of tide, all land under these waters, and all land within 1,000 feet of the landward edge of tidal waters and tidal wetlands. Local governments are required to adopt the state-produced maps. The Commissioners held a public hearing on the new 1,000-foot critical area boundary maps on March 2nd, 2021. At the public hearing, the Commissioners discussed the possibility of requesting approval from the Critical Area Commission to allow some grandfathering or other exceptions for projects that could be undertaken and completed using the current critical area boundary. The ordinance was tabled and staff was directed to write a letter to the Critical Area Commission requesting clarification on grandfathering of existing lots. On March 9th, Critical Area Commission Chairman Deegan, Critical Area staff, Commissioner Hewitt, Dr. Bridget, Dave Weiskopf, and I met virtually to discuss the grandfathering possibility. Also on March 9th, Chairman Deegan sent a letter to the county with an example of a limited exception for using the existing critical area boundary that had been approved for another county. Chairman Deegan suggested St. Mary's County appear at the April 7th Critical Area Commission meeting to ask for an extension on adopting the maps for time to consider the limited exception language for building. The ordinance to adopt the new 1,000-foot critical area boundary maps was presented to the Commissioners of St. Mary's County at your meeting on March 16th. After discussion, you commissioners tabled the ordinance. County Attorney and Land Use and Growth Management incorporated the language that would allow for limited exceptions using the example provided by the Critical Area Commission into the ordinance adopting the maps. The limited exception language is in the ordinance that is before you today. The language in the ordinance you have today was sent to the Critical Area Commission and was shown in this PowerPoint presentation on April 7th. But at that meeting, the Critical Area Commission approved an extension for adopting the maps. They saw the other language, but they didn't vote on it at that time. The commissioners of St. Mary's County are being asked for a decision today on the maps and the text with the limited extension for building. The commissioners do not have any latitude regarding the maps themselves. The maps have to be adopted. If the commissioners adopt the maps and the text providing a limited extension, the language for the extension will still have to be approved by the Critical Area Commission.
Okay.
Mr. Hunt, I thought we were going to give 2 years.
We've had 2+ years, sir.
I thought when we adopt the maps, there was 2 years for the individuals or parties to apply for a waiver, and I thought that would make it 2023. I read the pending legislation, it says 2022.
Permits associated with using the extension, if you adopt the language, will have to be issued before 2022. And then the work approved by that permit initiated before May 18, 2023.
I thought we had given them an extra year. I apologize. The more we can give them, the better off we are, since this is being another Annapolis take. Okay.
Mr. Hunt, has people reached out to you to apply for permits? Has this extension period changed anything with anybody?
No, sir. I've had a few questions. I'm aware of one property owner who has a permit that's under review that would probably like to take advantage of the extension. But other than that, no one else has come forward and said, I'm glad you're doing this. I have something I want to get in.
I want to move to approve the proposed amendment to the official zoning maps to delete the existing 1,000-foot critical area boundary line and replace it with the new 1,000-foot critical area boundary line from the statewide base map as required by HB 1253, and the amendment to Chapter 27 of the St. Mary's County Comprehensive Zoning Ordinance, Chapter 285 of the Code of St. Mary's County, Maryland, to allow the limited exception of property owners to build using the current critical area boundary line and have Commissioner President sign all related documents.
Second.
I got a first and second. All in favor?
Aye.
Aye. Any opposed?
No.
One no?
Yeah.
Is that correct?
Yeah, I said no.
John O'Connor said no? Passed.
Thank you.
Next, we have the Office of the County Attorney decision, St. Mary's County Public Ethics Ordinance Revision. I think Mr. Murphy is going to present.
That's correct. Good morning, Commissioners.
Good morning.
So we're here this morning for the adoption of the 2021 Ethics Ordinance revisions that my office conducted in accordance with originally from the 2019 and 2017 updates that were required by the state, as well as working with the Ethics Commission. And I have David Willenborg, the chair of the Ethics Commission, on WebEx today, and also Joseph Densford, the attorney for the Ethics Commission, is also present today. So in this case, or in this matter, the Ethics Ordinance was updated with a few respects, one of which was to mirror the organization of the Ethics Ordinance with the state, just for structurally, less content. More importantly, however, it was to amend how often, or the the exact financial disclosure statements that were required to be obtained or retained, and to provide for an amendment as to whom retains those, and that's Diane Gleisner, who received the LOSAP award this morning. And then also it was to require that if somebody files for candidacy, if they do not file their financial disclosure statement within a prescribed period of time, that time being 8 days, their candidacy is deemed to have been withdrawn. A public hearing, or I came before the commissioners in April, on April 13th, to request a public hearing. The commissioners then approved a public hearing. Notice ran in the Southern Maryland News. Public hearing was held about 2 weeks ago on May 14th, or exactly 2 weeks ago on May 4th. There were no speakers, no written comments, no video submissions, and no emails received. Therefore, I ask if Mr. Willenborg has anything to say, but if not, I ask that the commissioners approve the ordinance.
I move to approve and execute the proposed amendments to the St. Mary's County Public Ethics Ordinance and have the Commissioner President sign any related documents.
Second.
Discussion. Tell me, is this ordinance now, does our ordinance mirror the state ordinance? So if the state says something, are we obligated to follow the state? Does that trump, say, our ordinances that we have here?
That's a great question. So the state ordinance only applies to state employees. Our ethics ordinance applies to county employees and officers and elected officials.
Okay, I guess my point is ours as stringent as the state's? Will it be the same?
Sure. So I guess the best way to describe when I mentioned that it mirrors the structure, it was just to make it easier to follow, more or less. There's some things that were added, one with respect to lobbyists, but that doesn't really change anything for us. But no, the stringency, my interpretation would it's the same as it was before, just changing. I guess if there would be one thing that if you didn't file your candidate or your financial disclosure statement within 8 days before this, your candidacy wasn't deemed to have been withdrawn, and now it is, but that's a requirement from the state.
Again, I guess what I'm going for here, is there any difference between our ethics ordinance and the state ethics?
There are some differences, but mostly I'd say it was always pretty similar, and I suppose now it's more structurally similar than dissimilar.
So Mr. Willenborg, would you like to weigh in with your thoughts on this? Since you've been sitting patiently waiting for us to talk about it.
I think you're muted, David.
Mr. Willenborg, we cannot hear you. Is your microphone turned on? I see you've unmuted, but is your mic setting full on, Mr. Willenborg? He's doing a little bit of troubleshooting. We'll stand by, sir, please.
Just give us a thumbs up if you think this is a good idea. All right, there we go.
Good, David. That's good. We can't hear you. Any other questions, Commissioners? I have a first and a second. All in favor? Aye. Any opposed? Ayes have it.
Thank you.
Thank you very much.
Thanks, Dave.
Next we'll go right into county attorney time.
Oh.
County administrator.
I think
Mr. Weisskopf.
There you go. I'm sorry, county administrator.
That's okay. So
Come on, all these attorneys around here.
So on county administrator time, 7A is your draft agenda from May 25th and June 8th. Just a note, there is no meeting for the commissioners on June 1st. So next week on May 25th, you have invocation and pledge. You have a proclamation by the LGBTQ month. Department of Human Resources for their Years of Service Awards. The Department of Finance has the Commissioners of St. Mary's County sets rates and approves the FY 2022 operating and capital budgets. You have a closed session scheduled for personnel, boards, committees, and commissions. And then that evening, you have a public forum at 6:30. Then after that, on June 8th, you have your Years of Service Awards from the Department of Human Resources. Then you have the Department of Land Use and Growth Management with the decision on the proposed ordinance to allow private piers in waterfront subdivisions that are platted prior to December 31st, 1994 that have a community pier. You do adjourn that afternoon, and then there's an outside event, the first one in
A year, 2.
15 or 16 months, and that's across the way at the ribbon cutting ceremony at the St. Mary's County Detention and Rehabilitation Center. So we're excited about that. Today, Commissioners, I ask if you're able to, or you feel comfortable moving up Mr. Cody, who's on the phone, item E, the Office on County Attorney for FDR Boulevard. Are you comfortable moving that one?
Sure.
Up?
Sure. Yeah, sure.
Okay, great. Mr. Weisskopf, would you like to introduce your option, please? Again, this is Office of the County Attorney, FDR Boulevard.
Thank you. And with me is outside counsel Joseph Densford, who helped greatly with this, Alan Settle, who knows more about it than anybody in the room, at least as far as the technical aspects, and Mr. Cody, the owner of the property, is online, and his attorney, Paige Wyrow, is seated in the audience. Oh, I'm sorry, John Dietrich's beside me, and Alan Settle is behind me. What we have done is Mr. Cody has, after negotiations, has signed the option contract for about 2.7 acres for the third phase of FDR. And, you know, we had a rigorous back and forth and came to a agreement that I think all sides are happy with. I don't know if there's any questions about it or what you all would like, or if Mr. Cody has anything he would like to offer. But have any questions? Do you want more explanation of?
I move to approve the option contract with Cody Holdings LLC for property acquisition for FDR Boulevard. Authorize the Commissioner President to sign the contract and any related documents.
Second it.
Discussion. He's not ready. Is there going to be 2 dealerships there or 3 automobile dealerships there?
Mr. Cody, would you like to speak to that? He's probably the best one.
It's cited for 3, although we currently do not have a third agreement to put there.
Okay. Will they all be on Route 235? I see there's 2 side by side there. Is that the concept? They would all be lined up next to each other?
Yes, that's the concept.
Okay. Thank you.
Any other questions, Commissioners?
I'm just glad to see this is moving forward finally. Thank you, Mr. Cody, and everyone at the dais for getting us there. And, you know, my hope was in 12 years to have a road, but if I get 3/4 of a road in 12 years, I guess we're doing good.
We're getting there.
Yeah.
Any other questions, Commissioners? I have a first and second on the motion. All those in favor? Aye. Any opposed? Ayes have it.
Thank you, Commissioner.
Thank you all very much for being here.
Thank you, Commissioners. And we're going to jump back to 7B, Department of Public Works and Transportation, with the 2021 Christmas in April resolution to waive tipping fees. Mr. Dietrich?
Thank you very much. It's a great pleasure to bring this before you. And do you have? Oh, we don't. I don't have any representatives with us today of the group, but it's a great pleasure to bring this before you. I think the petition itself speaks for itself, the incredible service this group has provided over the years for a very small budget item. We've got the $4,000 plus in our budget to cover the cost of the disposal of all the debris that results from this activity, which is both junk that gets picked up, but also like offcuts from lumber and that sort of thing.
Here they are.
Hey, showed up. You're just in time.
Doreen, you're so good.
You're okay. You're just in time.
Yeah, front and center in the center, too.
Good morning.
Morning.
Thank you for having us again and supporting Christmas in April. This is going to be our 31st year of serving the county. Our numbers are pretty good for the county. We've so far done 832 homes, 23 community projects, used the services of 43,500 volunteers, donated $7.9 million worth of repairs, and this year is going to hopefully be a normal year. We actually picked a good day. Everything's going to be gone on Saturday, so that's going to be great. We're doing 16 projects all over the county, and of course we're always including the fairgrounds because y'all are always so generous with our warehouse and everything there. And this year we're doing hospice house as well. We're doing some outdoor work there as well. So. Last year was a disaster, but we did get some things done.
Good.
So we've rolled over the houses from last year that we couldn't finish, and we're going to do them again this year. So we appreciate your tipping fees. It makes a big difference in what we can afford to do because as a nonprofit, we're really hurting financially because other nonprofits support us that haven't been able to do their fundraising and that kind of thing. So and we have put in for the grant that you guys have put out, so hopefully that will come around, and we appreciate that support too. So,
Well, keep in mind, we have another grant out there that hopefully, if you haven't already applied, you will pretty soon. And have you applied for our newest grant?
yeah, the one that is up on June 7th? Yes.
Yeah.
I applied for that one. Is that the latest one?
Probably, yes.
Okay,
Yeah.
okay.
There's
yeah,
a lot of them.
applied for
I'm
that
glad
one.
you have.
I appreciate it. Your support is, we can't do it without the county support, which we live in a great county. Anything you want, you need, the county is willing to give it up for us. So we appreciate all your support that you give us. So.
Well, I move to adopt the resolution waiving the landfill fees for Christmas and April projects associated with the annual program scheduled for Saturday, May 22nd, 2021.
Second.
Have a first, second, all in favor? Aye. Any opposed? Ayes have it.
All right.
Also, we have a,
I do have some gifts for you if I could leave them somewhere. for you all.
Thank you.
Inside the bags is
Give the addresses.
the address of all our projects. Yes,
Thanks,
Don,
Doreen.
I know I'll see you there somewhere. You're always very supportive of us, and we appreciate it. Thank you.
Also, I have a proclamation to give to you also. This is to you, of course, as the director, president. Oh, you're the executive director, I'm sorry.
Pardon?
You're the executive director?
Yes, I am.
Right, there you go. Okay, whereas Christmas in April will celebrate their 31st year of home repair in St. Mary's County on May 22nd, 2021, and whereas over 43,500 volunteers have performed over $7,900,000 worth of repairs on approximately 832 homes and 23 nonprofit community facilities occupied by elderly, disabled, and low-income citizens since 1991. And in partnership with the community, has rehabilitated the homes of low-income homeowners, particularly the elderly and disabled, so that they may live in warmth, safety, and independence. And whereas Christmas in April has improved the quality of life and safety of over 3,000 St. Mary's County residents, and whereas Christmas in April proposes to repair 13 homes and 2 community projects in St. Mary's County during the Helping Neighbors Day on May 22nd, 2021. Now, therefore, we, the Commission of St. Mary's County, do hereby recognize Christmas in April and St. Mary's County Incorporated for their outstanding service and commitment to St. Mary's County. Thank you very much.
Oh, that's wonderful.
Patient right there. John, give it to her. And we'll get a little photo op here.
Just show the
Okay.
proclamation photo.
Yeah, open it.
Thank you very much.
Thank you so much. All right, well, thank you for your time.
Well, thank you very much for all you do.
Have a good day.
Me too.
Thank you, Commissioners. And item C is from the Department of Economic Development with the agreements with the NAV Air Warfare Center Aircraft Division and NAV Air Systems Consortium to operate in the Techport. Mr. Kasalimas is presenting.
Thank you, Dr. Bridget, and good morning, Commissioners. A little bit of history. Back in 2017, the Tech Transfer Office of NOC-AD received federal funding to establish a business incubator in St. Mary's County. NOC-AD came to the county and asked if we could set up a technology incubator, and we said yes, we can do that, as we many times do. They awarded us $2 million for that purpose. We worked with S. Hunt Aero to construct a building. We designed it with them, picked out all the materials. In 2017, St. Mary's County entered into an agreement with the University of Maryland for $1.35 million to operate Techport for a 3-year period. That ended recently, and on May 5th, the University of Maryland informed the county that they would no longer be operating Techport due to lack of funding. As you remember, the county commissioners did agree to provide $108,000 to help sustain Techport, but no other funding became available. Fortunately, in anticipation that this could occur, we've been engaging with other potential tenants to continue Techport. We're excited that both NOC-AD and the Naval Aviation Systems Consortium, NASC, have agreed to move into Techport. NOC-AD will bring the following programs, and there are write-ups in your materials to give a little more detail, but NOC-AD, Pax River was awarded recently a Tech Bridge designation by the Navy. The goal of Tech Bridge is to increase collaboration, knowledge sharing, and innovation with leading-edge tech companies and innovation partners. Tech Bridges offers a collaboration space in a commercial business space rather than on base. NOC-AD is also bringing Impacts. This is NOC-AD's partnership intermediary for experimentation, technology demonstrations, and prototyping. They do this through the Georgia Tech Research Institute, GTRI. Impacts connects small businesses to help solve Navy warfighter problems. They're also bringing part of AirWorks to the Techport. The AirWorks concept promotes rapid development, rapid prototyping, and lead systems integration to deliver product-based capabilities to solve warfighter requirements. And then the NASC, the consortium. The NASC was formed to support the technology needs of the NOCs and the Naval Air Systems Command. They target non-traditional defense firms, companies that have not had a traditional DoD contract within a year. Really smaller companies. They focus on prototyping again, hardware, software, and business practices. In addition to the tremendous array of technology and innovation that these entities bring, they also help pay the majority of the lease. So what we're proposing is that each pay $37,500. That is $75,000 towards the lease obligation that we have with S. Hunt Aero of $95,000. That would result in a $20,000 deficit, and we're recommending that come out of the $108,000 that the commissioners already approved for Techport. And we're also recommending that the remainder, $88,000, remain in the DED budget for possible building modification, equipment needs, and supplies during the year. Just a word about the Airport Innovation District. Techport is a central asset of the Airport Innovation District. What we're bringing to Techport with these new tenants is all about innovation and technology. The Innovation District only thrives if real technology innovation occurs there. So this will be the first real connection between NOC-AD and who's our most important employer in the Innovation District. With the SMART building, that's the name of the new USM third building under construction, and Techport, the Innovation District can truly claim that this location is a hub of innovation. We have a couple letters of support in your packet. We have one from the Vice Chancellor of University Systems of Maryland, and also from Ken Reed of S. Hunt Aero. And please remember that S. Hunt Aero is the building owner. They own the Techport building. They lease it to us. And I just want to point out, like I always do, that Ken Reed is a great partner. He helps us in so many different ways at the airport. He also provided a lower cost lease for the first 3 years. So today, due to the short time frame, we weren't able to finalize all the agreements, but we're asking commissioners today to approve these moves into Techport and to enter into the agreements when they are finalized. Very excited about these moves.
Now, how long will this agreement last?
It'll be a 1-year agreement.
Okay. So will it be renewable?
We can renew it. Yep, we have with S-Hunt Aero, we have the option to continue to renew leases, I think for another 3 or 4 years or something.
Who has the option to renew the agreement for the NAC-AD?
So we'll come back in a year and see if they want to continue, and if the commissioners want to continue with that relationship.
Be mutual.
It'll be mutual, absolutely.
Thank you.
And also, just as an aside, commissioners, I did talk to the University System of Maryland. They're focused on getting that third building up and ready. But I said if there's you guys want to come back to the Techport, there'll be a place for you in Techport because it is a collaboration space. So there'll always be space for the University of Maryland and USM.
Good, good.
I move to enter into agreements with the Naval Air Warfare Center Aircraft Division and Naval Aviation Systems Consortium to operate in Techport, and have the Commissioner President sign all related documents.
Second.
I have a first and second. All in favor? Aye. Any opposed? Ayes have it.
Thank you very much, Commissioners.
Yes, means thank you.
Mr. Kesselim has received an amazing compliment about you related to this, basically that you're working very diligently and that you're working your tail off, basically. I'll put it nicely. Well, nicely, but in television terms.
That's why he's so slender.
That's it.
I appreciate
it. So.
Commissioners, item D is from the Department of Aging and Human Services with the FY 2022 Retired and Senior Volunteer Program, the RSVP Year 3 of 3 Notification of Grant Award. Lori Jennings Harris, Director, presenting.
Hello, Ms. Rowe. How you doing today?
Thank you, Dr. Bridget, and good morning, Commissioners. So joining me is Noreen Rowe, the Program Manager for the Retired and Senior Volunteer Program. So presenting to you is the FY 2022 Notification of Grant Award for the RSVP program. This is the third grant award in a 3-year grant period. The grant amount from formerly the Corporation for National Community Services, currently known as AmeriCorps Seniors, is in the amount of $50,000. The grant term runs from April 1st, 2021 through March 31st of 2022 for a total budget of $121,478. Ms. Rowe would like to give you a very brief program update, especially since we've had some challenges over the last year.
I'm sure it has been.
Well, thank you for this opportunity to speak before you about the Retired and Senior Volunteer Program, of which I am always very proud. Certainly exceedingly challenging year, with our senior volunteers being in the high-risk population with COVID-19. That said, we still had over 100 volunteers who were able to serve at least some hours over the past year, and they invested more than 11,000 hours of service for St. Mary's County.
Wow.
To meet critical community needs valued at more than $300,000. So even during a very tough and challenging time, our volunteers did their very best to step up to the plate in safe ways that they were able to do. And we pivoted early on with the pandemic starting last April, and we got together a team of RSVP volunteers to make handmade face coverings out of the safety of their own homes, and to make these face coverings for community members in need, as well as nonprofit organizations and county agencies, STS buses, law enforcement personnel, rescue squad personnel, senior living facilities, veterans home, and to date, these volunteers have made more than, and we track every single thing, 5,747 masks.
Wow, good.
Quite incredible. And they've put in more than 3,500 hours of service, and we're talking about 9 volunteers who accomplished that. So these volunteers have been working really, really hard.
Burning them sewing machines up.
Yeah, really hard. And the masks have gone to a lot of people, not only to organizations in need, but individuals in need who could not afford a face mask. They were also mailed to individuals in need or dropped off safely outside their home. So we did all of this with safe distancing protocols in place. Materials were dropped off on a weekly basis on the doorstep of the homes, and then the following week, the masks were picked up from doorsteps. And I have to give credit to my assistant, Andrea Wilson. She's the boots on the ground person who's been doing all of the physical outreach for this. And so I really want to give credit to these volunteers. They are still working as long as the need exists. And we're all hoping that sooner than later the need will no longer exist. But they really deserve much, much credit. And additionally, I want to mention that ACTS, a community that shares, has managed to serve throughout the entire pandemic, which is pretty incredible. Over the past year, 27 ACTS volunteers with RSVP served almost 5,000 hours of service. They distributed almost 3,000 pieces of convalescent and assistive medical equipment to more than 1,800 citizens of St. Mary's County. And so this was deemed a critical service. They were vaccinated early on as essential workers, and even though they're volunteers, and they have literally been serving throughout the entire pandemic. And so they really deserve a lot of credit for stepping up to the plate. They also provided hospital beds to MedStar St. Mary's Hospital for the auxiliary units that were built. And the state of Maryland is also has developed a similar regional facility to what ACTS does in Cheltenham, Maryland. And they launched in the fall, still in the midst of the pandemic. And ACTS was able to provide them with inventory to help with the launch of their new warehouse for a regional facility. So they have gone above and beyond during the pandemic to offer just great essential services that you don't know until you need them how important they are. You know, the convalescent equipment that can get very expensive, and not everyone can afford to buy it or rent it. And so, and we do surveys of all the people that receive the services, and the comments are always 100% glowing, that they appreciate, they can't believe the county offers a service like this. They're amazed at it, and they are exceedingly grateful. And they also always comment on the kindness and helpfulness and knowledgeability of the volunteers. And so they really deserve a lot of credit. And I don't want to take much of your time, but I do also want to mention that the Helping Hands Food Pantry has continued to serve throughout the pandemic, another critical service for our community, especially during these trying times. And they, with 17 volunteers, more than 1,300 hours of service, they served 1,779 families, 1,456 individuals, and gave groceries valued at more than $117,000. So again, people stepping up to the plate, even though they were vulnerable seniors, putting safety and health protocols in place to continue to provide services. So, and we have others. Teen Court, you probably have heard that they developed a video digital format to be able to continue offering teen court services in a safe way. And we have some rescue squad personnel that still manage to serve. So it's not a year that is our typical high numbers that we like to be able to share, but it still is amazing. Considering the challenges that were faced, our volunteers are really tried to do their best to meet community needs as best as they were able. We just launched a new project called Senior Connections Project, and again, we have volunteers working out of the safety of their homes, and they are making handmade, beautiful, put Hallmark to shame, greeting cards that are being sent to isolated homebound seniors. The COVID-19 has been very difficult for everyone, but for people who are homebound, isolated seniors, especially so, needing social connection. So we are creating homemade greeting cards being sent to individuals on a weekly basis. Beautiful, beautiful cards. The recipients really appreciate them. And we're also sending letters of gratitude to frontline service personnel. And in just a really very short period of time, we've had 810 cards have been made. 729 hours, 15 volunteers, and so we've been distributing them not only to individuals in need, but to every resident of Charlotte Hall Veterans Home, to nursing homes and other facilities where people could use a friendly greeting and a warm connection from another human being. So those are kind of some of the things that we've been doing during COVID-19 when we couldn't do all of our other volunteer service activities that had interaction involved, physical interaction. So we appreciate always the support of the commissioners. Just as a county employee, I want to say that I appreciate the support of the county administrator and all the county commissioners for keeping employees healthy, safe, and employed during COVID-19. I know everyone has worked really hard, and I think what you all have done has been fantastic during this trying time. And also the Department of Aging, part of the gratitude cards that we're sending to frontline personnel went to department staff, who I personally saw how hard the staff worked to vaccinate seniors in St. Mary's County. And they really put in so many hours, and it's quite an honor to be part of this department where teamwork is really a model of excellence, and everyone pitches in to make good things happen. So I'm proud to be part of the Department of Aging and Human Services, an employee with St. Mary's County government, and very pleased to represent this great team of volunteers with the Retired and Senior Volunteer Program.
Well, Ms. Rowe, I want to thank you for not retiring like you told me you were going to do about a year and a half ago.
COVID-19 has a way of changing so many plans.
Well, I sort of missed my $1 million check you've been passing.
I know. When I saw that check earlier, I thought, I don't have my check this year.
I thought that was for me, but then it was for something else.
Right.
But no, but I do appreciate all you've done, and you've been fantastic doing these programs, and I'm glad you're continuing on. I'm glad you didn't retire.
Thank you. Well, it is definitely on the horizon, but I wanted to, we have a new 3-year grant that needs to be written later this summer, so I want to help with that process. And I didn't think that the pandemic was a good time to, especially with a hiring freeze, to make an exit. So I want to be able to make a successful.
I twisted her arm, actually. That's what happened.
Twist her arm a little bit, say, you got to stay, you got to stay. You've done a fantastic job, especially with the retired seniors and volunteer program. It's a fantastic, I know volunteerism in our county is tremendous, and to see all those seniors at those luncheons we used to have, I'm sure hoping the coming year we'll supposed to have another one, and to see all of them there, and they were just very pleased to be serving, and of course they always praise your leadership.
Yeah.
And we thank that very much.
Thank you. Thank you so much. And the seniors are eager to serve. I think as soon as we know that we can safely re-engage, we're going to be doing it on a gradual process, hopefully to get back up to speed.
Good. Very good.
Yeah.
Looking forward to that.
Thank you so much.
You give a lot of accolades, but you're the one who really drives this thing as a program manager. It's your leadership, your commitment, your compassion. That's what makes it work. It's because of you it's been so successful. Thank you.
Well, God bless you. That is so sweet to say, and I appreciate that. It's always a team, you know. It's always a team.
I know, but you're the lead.
Yeah.
Someone's got to be the leader.
I move to approve the Retired and Senior Volunteer Program RSVP Year 3 of 3 Grant Award Project US 2110 from the Corporation for National and Community Service AmeriCorps Senior on behalf of the Department of Aging and Human Services in the amount of $50,000 to continue this volunteer program. The related budget amendment to increase the project budget and authorize the Commission President to execute the related documents.
Second.
Got a first and second. All in favor? Aye. Any nays? Ayes have it.
Thank you, Commissioner.
Thank you so much.
Thank you very much.
And Commissioners, we go to 7F for the Department of Finance for the budget amendment to realign county personnel services and snow removal accounts FY 2022. Jeanette Cudmore, CFO, presenting.
Good morning, Commissioners.
Good morning.
It's wonderful to come behind all the wonderful people that have already been here at this table and recognized. The annual snow removal budget includes equipment rental, salt, sand, and nominal overtime cost. However, the annual actual cost depends upon the level of support based on the type of storm, intensity, duration, timing, rush hour, overnight, regular hours, geographic distribution of event, and temperatures, pavement versus air. DPW does an awesome job. and they prepare the annual storm cost, and the difference between the budget and the actual is realigned with the Commissioner's Emergency Reserve. So we have two BAs that are in front of you today. The first BA will be taking care of all the emergency pay, realigning within all the department accounts, and then moving whatever the difference was that we can move to the commissioners, which is actually $274,620. So your actual Commissioner's Emergency Reserve is $699,000 right now. So after, and we're decreasing accounts by about $1,097,000 because we still had a number of vacancies this year. We came to you back in December and we put money in your reserve at that time. Well, this is a remaining that we feel that will not be needed. And this doesn't include the sheriff's office or elected officials. This is just truly county departments where we're removing these funds. But we did take care of, for emergency snow, $619,370, and that does include the elected officials. $203,000 were taken care of for any shortfalls that might have been in a department based on any hirings compared to the original budget. And then for the snow removal, based on the report that we received from DPW Rick Tarr, we need to actually, over and above the budget is $771,000 that we need to actually take now from the Commissioner's Emergency Reserve. After we put the money in, we take it out, and that leaves you a balance of $202,255. So I didn't want to leave you at a zero amount because we still have to get through May and June. So yes, I think we're lucky that we, like last year, I don't think we had any storms at all, or we didn't need to come. And it's, it's amazing, every year we come, we actually have money in your reserve. A lot of it has to do with salary reconciliations to put the money back in your reserve. So we've been able to take care of it. And I think we said probably 2 years ago that we probably should do a better job at budgeting our snow removal, because one day we may not have these additional funds to take from your Commissioner's Emergency Reserve, and we want to make sure we still are able to cover the cost. So in addition to this, I also wanted to let you know that we need to finish reconciling Tropical Storm Isaiah that happened in August. There's emergency-related cost that was for that storm. We're going to move that to that project, but I was very excited to hear that there's FEMA money available for the operating cost and for the two projects that are in the capital improvement project. So I'll probably be coming back, I think, with some CIP reconciliations on June 8th and take care of and set up the budget for those, the federal budget. All right.
Ms. Cudmore, I think you hit the nail on the head. I've always been a little nervous that we don't budget a little more for snow removal, and last year we got really lucky, and this year we're paying the bill for it, but it's just something that next year, let's think about that earlier in the budgeting process.
So in the 23 budget?
Yes.
Okay.
So that we can make sure we take that into account a little better.
Yes.
Well, I move to approve the budget amendment in the amount of $1,097,000, increasing $822,380 in salary and fringe accounts, and transferring $274,620 to the Commissioner's Emergency Reserve due to salary savings over the needed cost for snow removal, and approve the budget amendment in the amount of $793,070 for non-personnel snow removal costs, and reducing the Commissioner's Emergency Reserve by $771,944.
Second.
Got a first and second? All in favor? Aye. Any disapproval? Ayes have it.
Thank you, Commissioner.
Thank you, Ms. Cudmore.
Thank you.
Thank you, Commissioners, and this completes County Administrator time.
Okay, well, let's go right into Commissioner time. We'll start with Commissioner Morgan this time.
Thank you, Mr. President. Do some fun things. First of all, this past Saturday, I had the opportunity to go to Abigail McDaniel's Eagle Scout Court of Honor. Abigail is the first first girl Eagle Scout Court of Honor we've had in St. Mary's County. It was really well attended, and I said to her, it was 50 years ago I got my Eagle Scout award, and how things have changed since then. So to Abigail McDaniel, and there's another girl preceding her who have an award ceremony later on this year. Congratulations to our two newest girl Eagle Scouts. We had a birthday in the county the past week, and that gentleman always watches television. He's probably watching me right now, so what's he going to say? That's Ernie Bell. So Ernie, I know you try to keep it a little secret, but 4 scores to you on that birthday event. Lastly, I'm wearing green. Why am I doing this? Well, anybody watch college soccer? Probably not. So last night we had the national championships. And last night the Santa Clara women beat Florida State, the #1 team, 4-1 on penalty kicks. But that's not why I'm wearing green. I'm wearing green because Marshall University won the men's national championship last night, 1-0 in overtime over Indiana. Indiana have an 8-time national champion, and for Marshall, this is our first national championship. So I say, we are Marshall. Thank you.
Go Herd.
All right. So last week had the opportunity to ride a school bus for the first time in, I can't even remember. It was very interesting how they've come a long way. I remember riding the bus. There's no air conditioning, no tinted windows, no video cameras, and it was basically a metal shell, and that's about it. However, they still smell the same, like a school bus. That I don't think that's ever going to change. So I appreciate the lift over to Chopticon. Got a chance, take people up on their offers and the invite and the challenge. Got to go visit some of the teachers, see the school. The most interesting thing was sitting in Mr. Hance's class, who was the one that gave the challenge, and having the discussion about the filibuster. So that was really cool to see the interaction with the students and their line of thoughts, and getting called on randomly to go ahead and say something, and then trying to get the class to debate me, which didn't happen, although there was one student there that just wanted to disagree. So that was just interesting. But it was a good time, so I appreciate that. Then they had their tailgate prom, which was pretty cool. There was everybody from the sheriff's office, fire, rescue. Our recruiters were there. They had DJs. They had the ice cup. What are they called? You just had one, Commissioner Morgan. The ices. What are they?
Kona?
Not Kona, but I don't know why I'm blanking out on
Ice.
Thank you. Shaved ice. And my son enjoyed that, of course, and he had to ride his bike around. So that was definitely a great experience. Lion Farms, strawberries. What can I say? Everywhere, strawberries, amazing. They got great strawberries. They had an amazing event, so if you can get down there, pick some strawberries. They are delicious. I don't know about the other places, but they are sweet, ripe, ready to go, and I think you'll have a great time with the family out there. We had the car show with the East Coast Drifters. Just amazing. 347 cars. Reason I say all these things is because we're moving to a point where people are getting back out, and it is great to see that we are participating in things as a group, as a society again, as people in this county, and because that is something that was truly, truly missed. So I was just glad to be able to attend some events and see people back to normal. I mean, it was just amazing. Last, but certainly not least, Dad, happy birthday. I know you and Mom watch, and I want to just say happy birthday. I'm so glad you guys were able to come down here from New York and see little John grow up and just be so much closer, where it's just a car ride. And, for so many years being in the military, didn't get a chance to see you guys like I wanted, and now you're here. So happy birthday. I look forward to spending many more of your birthdays with you and having little John jump around and hopefully not injure you like he tries to do all the time. So, all right. Love you, Dad. Thanks.
Good. Very good. Well, happy birthday, Mr. O'Connor. Happy birthday, Ernie Bell. I wish you all a happy birthday. If you're watching this right now, I hope you tune in this afternoon, because we have our last budget work session at 1:30 this afternoon. I'm looking forward to it. I think it's going to be great. I think we're going to end up with a budget that's just going to be a perfect budget. It's going to be the best budget you've ever seen. It's going to be great. But if I had to pick a theme for today, for our commissioner meetings today, I would say it was a day of recognition of service in St. Mary's County. So this morning we presented a proclamation for EMS Week and all of the volunteers that make our EMS system work and operate, incredible service that they do. Then we were able to witness the presentation of the check for the Commission for Women's scholarship that they provide, that they do every year. A lot of work goes into that. We were able to waive the tipping fees for Christmas in April and present a proclamation for their 31 years of service. And then we were able to approve the next or the last of the 3-year grant for the RSVP program and all the service that's done through that. Service in St. Mary's County, it's one of the many, many things that I love about our county. It's absolutely incredible how many people are serving, how many people want to be here to make our community a better place and continue to live here. So thank you all for however you serve, however you help those around you. Thank you.
Thank you. Mike.
Thank you, Commissioner President Guy. Yeah, good news. The CDC and Governor Hogan lifted the mask requirements if you're fully vaccinated. And I was in a lumber store, Dyson's over there in Great Mills. I love that place. And they required masks. And I said, look, they've lifted them. They've lifted them now. And the guy said to me, how do we know if you're vaccinated or not? And I thought to myself, that's a good question. I love seeing this idea of having something on your phone that the health department can do and give you a barcode. And it will help. It'll help people. But I also want to say, want to strongly encourage people who haven't had vaccines yet to get them. It frees us up. Now, does it make us totally safe? Listening to Dr. Brewster today, probably not. But it is a step in the right direction, and Lord knows we've been waiting so long for this to get here where we do not have to socially distance or wear our mask. So thank you, CDC. Thank you, Governor Hogan. Commissioners already decided we will follow the governor's orders. But I understand it's a personal choice. And so whatever your personal preference is, it should be totally respected. But the good news is we're getting past this pandemic. Secondly, I had the opportunity to meet yesterday with the 2 board members from Metropolitan Commission, Russ Russell, he's the chair, and Keith Dugan, the newest member. And we visited the St. Clements Shores wastewater treatment plant out in St. Clements Shores. And what's important about that is we've done a lot of work there in the last 5 years to get people who have failing systems to hook up. And our goal is to find grant money to put in more infrastructure and hopefully service more people and clean up our bay, do our part. But it's good that we're working collaboratively, excuse that word, together, that we're going to make this happen, and hopefully we'll make it happen in the next 18 months. Lord knows I've been working on it a long time, and it'd be nice to see it come to fruition. Lastly, like Commissioner Colvin just said, we got our last budget work session today. As this being, I guess, my 7th now, I'm not sure it's going to be the most perfect. I'm not sure it's going to be the best one ever, but it's going to be the best we can do. Will it satisfy everybody? Probably not. But we've done a lot, and we've given a lot, and we think we can do a little bit more. But at the end of the day, there's only so much to go around, and hopefully we'll allocate it appropriately, and people will be happy. Thank you.
Thank you, Commissioners. And I'll echo that again. 1:30 this afternoon is our final work session, and this will we're seeking a final direction for our budget. And it has been a trying time, and we're not sure. Still, you have to look past a few feet in front of you. It's the future of the county, years to come. We're not sure how all this is going to impact after COVID. We've got a lot of things we've done, capital improvements and everything. We've got a tremendous amount of new FTEs we're going to commit to, and these are recurring expenses that we've got to look at and make sure we got enough money to fund this. And hopefully we can do the right thing, make right decisions. Sunday, I had a chance to take one of our museum trips from St. Clements, around St. Clements Island, St. Clements Museum, and then we ended up at this Morris Point for dinner. And I want to thank Miss Christine Barber for her efforts in doing this. It was well attended. Everybody, of course, paid their money. They were there, and it was a good trip. We had Dr. Gerard, who owned most of the area here at one time, give us a briefing on how he did what he did, why he did it, and explaining some of the history of Southern Maryland from the mid-1630s on to 17-something when he was here. And that was fascinating, and they did a very good job. That man was Mr. Mike Barber. He's a very good historian type of guy down there, and so I thank both of them for their work they're doing for this. I think I was told the future trips are already sold out. I think they had like 4 or 5 more. They seem to be all sold out. So I'm saying that we've got a lot of great programs here in our county with Parks and Rec, and I advise you to go ahead and sign up and use them. And like everything else, I want to thank all those who volunteer. I've been working with the DAV, that's the Disabled American Veterans, to find them sort of a permanent home to do their services. For those of you who don't know, the Disabled American Veterans is probably the top group that helps veterans secure things within the VA, loans, medical attention, both medical and mental. It's a great organization, and they've been scattered around the county trying to work in various. They were in the 2C box we just had, but they were thrown out during COVID. So they've been working out of VFW and other resources. So we're trying our best to find them a permanent home to set up shop where they can help our veterans. And thank you, DAV, for all you've done. With that said, don't forget our budget work session is at 1:30. And so we hopefully finalize everything at that time. Meeting adjourned.